Incidence and prevalence of type 2 diabetes and prediabetes is out of control in the industrialized world and certainly in the United States. We just did a video showing how in kids from age 10 to 19, the incidence has almost doubled in a 16-year period, and how we need to get more aggressive about diagnosing and treating both type 2 diabetes and prediabetes. Well, another paper came out showing how simple dietary interventions are proven for treating type 2 diabetes and how we have to change our goal of what we're trying to accomplish. It's not just managing type 2 diabetes, it's reversing and preventing it. I'm Dr. Brett Scher, the medical director at dietdoctor.com, and I want to review this paper because I think it's really important to help all of us with our mindset on how we're approaching type 2 diabetes. So the paper is called Dietary Strategies for Remission of Type 2 Diabetes, a narrative review, and was published in the Journal of Human Nutrition and Dietetics, with the authors being some familiar names in the low-carb world, Dr. David Unwin, Dr. Jen Unwin, and Dr. Campbell Murdoch. And they start off right away with their practice points that type 2 diabetes remission should be considered a treatment goal for people living with type 2 diabetes. And I love that statement right off the bat. We need to change our goal. And you've probably heard doctors say this all the time, that when I've said it many times, when I was in residency, internship, fellowship, even in the beginning of my practice, nobody was talking about remission or reversal of type 2 diabetes. We were talking about managing the complications, trying to lower the risk of complications by keeping the blood sugar in line and kind of thinking eventually you're going to get it, but just trying to delay the complications and really just trying to manage this condition that you're going to have for the rest of your life. Now we've turned that on its head. Now people are talking about remission of type 2 diabetes on a regular basis, but we have to get that in the general medical lexicon, that remission of type 2 diabetes is the goal, not management of type 2 diabetes, not trying to delay complications, but remission. And they came right out and said that in this paper, and I love that. Then they talk about what can be a big driver, and they admit that there is evidence to show weight loss about 15 kilograms or greater, and other studies showing maybe 5% or greater, can have a meaningful impact on blood sugar control and normalizing blood sugar, and that to maintain remission, maintaining weight loss plays a big role. And that's not a surprise. So you could say any approach that helps with weight loss is going to be helpful for type 2 diabetes. And that's probably true. I mean, there are some studies showing that regardless of mechanism of weight loss, you can improve type 2 diabetes. The question is it sustainable? And what else is it doing for the rest of your health? Whether it's bypass surgery, that's a very effective way, not heart bypass, but bariatric bypass surgery, weight loss surgery, that is a very effective way for treating type 2 diabetes and putting it into remission. And so are low-carb diets. There have been plenty of studies of low-carb diets for prediabetes and type 2 diabetes, and with remission being the goal, not management, but remission, and them being very successful at doing so. But they're clear in this paper that most of the data goes out to about 2 years, and that's true. We don't have, 10-year, 20-year data on a lot of these trials. But 2-year remission is pretty amazing without having to undergo an invasive surgery, just changing your lifestyle. So for people who can comply with a low-carb diet, or the other diet they talked about in the literature was a total dietary replacement, like shakes, but that's a little bit harder to maintain, I would think, at 2 years. And is it nutritionally sound? And are you getting all the macro and micronutrients you need? Is it as enjoyable? There are lots of other questions there that need to be answered. But if you can comply with a low-carb diet, carbohydrate reduction for 2 years, and you're enjoying it, well, there's no reason to think that that's going to stop working long term. If it's not the right diet for you, okay, that makes sense. You need to learn that and then find the iterations that can help. Higher protein diets can help, of pretty much any type, and lower carb versions of different diets like the Mediterranean diet or even vegetarian diet, lower carb versions of that may also be beneficial. But even though we don't have clear head-to-head trials, it certainly seems by the recent evidence that low-carb interventions are the most effective dietary intervention for treating type 2 diabetes and putting it into remission. The paper then talks about the needs for programs supporting people to achieve remission. And again, this comes down to the structure of our medical society. I mean, if you're going to see your doctor once every 6 months, they're going to check your blood sugar and tell you to eat less, move more, I'll see you in 6 months. What's the chance of success? Not very good. chances of success are not very good. And that's why, under the watchful eye of our medical community, the rates of diabetes and obesity have skyrocketed, not just in adults, but in kids as well, as we talked about in our prior video. Well, that's why at Diet Doctor, we are trying to provide resources for clinicians and patients alike to help you achieve these goals and to be the structure and the support that doctors frequently don't have. We have a new program called DD Pro, Diet Doctor Professional, DD Pro, that we want every clinician to be a part of, because what we're trying to do is provide the structure for the education, the content, the meal plans, the shopping list, the interaction, the way to get all this information to your patients. So if you're seeing them every 3 months or every 6 months, they're getting touch points much more frequently than that. They're getting instructions and information and guidance from us much more frequently than that. So it's less work on you, more success for your patients. That's kind of a win-win from a clinician, from a busy clinician standpoint. And let's face it, we need more programs like this. I mean, we need more programs helping busy clinicians who don't have the logistical framework, who don't have the structure in place to help their patients with a problem that is rising but can be cured. We can put type 2 diabetes into remission, but it does take work, it does take follow-up, it does take contact and education, and we have that. So if you are a clinician, I encourage you to check out DD Pro, so dietdoctor.com/DD Pro. Learn more about it. I'd be happy to talk to you about it personally. If you're a patient, talk to your doctor about it. We just want to provide these services to further help this mission of changing how we think about prediabetes and type 2 diabetes. It's not managing it, it's putting it into remission. And hats off to Dr. Unwin and his crew and Dr. Murdoch and everybody who put this paper together to really sort of bring it to the forefront, hopefully, of many physicians, many clinicians to take a look at and help them reframe their mind. All right, I hope you found this helpful. If you did, please click the thumbs up and the subscribe button below so you'll get all our updates here on Diet Doctor News on YouTube.